for me, adverse childhood experiences is why we need to do the work to make workplaces better. Um, because it is a huge unaddressed public health threat, and it has been for decades, that it's important that we start to look at this through the framing of workplaces being responsible for this. So I'm going to pause for about 30 seconds, let people read through this. If you want, you can mark down um, the number that you've experienced. If you feel comfortable, we're not going to share it. No one's going to talk about it. It'll be just for you. At least 70% of Americans have had at least one adverse childhood experience. There's a new study, there's an expanded version of the ACEs questionnaire. I used the original in the slide that I just showed you all. But there's an expanded questionnaire that has other things like bullying that happened during childhood, growing up in an unsafe neighborhood or an unsafe school environment, and a couple of other things that expand it. And so this expanded ACEs questionnaire, I believe with the original one, around 26% of people had experienced four or more ACEs. But with this expanded one, they've said it's around 37% of Americans have. And so it's more than one in three, or around one in four if you just look at the original information, which is still a lot of people who have these experiences that are associated with harm as an adult. So statistics on the right are the things that were the most stark from the study that came out. So a 1,200% more likely chance of attempting suicide, 1,000% more likely to inject intravenous drugs, 740% more likely to have alcoholism, 460% more likely to have depression, and 390% more likely to have lungs disease. And found relationships between the parents' jobs and the children's outcomes. And so something like autonomy, which if you follow a lot of the organizational behavior work, autonomy is a big deal for employee well-being and engagement. Being able to choose when, where you do your job, not being micromanaged, being treated like almost like an adult is a simpler way to say it. Is a really big deal, and that also makes a difference for children at home. And things like supervisor support were directly tied to maternal depression. So they gave an example of a woman who they she worked in a job where she was hourly and she had to, I think I want to say that there were jobs like the Dollar General or working in a grocery store, those sorts of jobs where you have to be there to do your job. Uh, but this woman had a manager who was willing to cover shifts and make sure that things were okay for her when she had a sick child versus another woman who didn't have that. And there are differences in how the child turns out when those sorts of situations come up. And so adverse work experiences are psychosocial and physical harms at work. And so I took a couple of different theories, mainly though relying on those adverse childhood experiences. There's a covert adverse experiences questionnaire that also came out in another doctoral researcher's um, her her work, and covert experiences are often much more acceptable in the workplace as a form of abuse. And so I relied on that theory, which is another adversity in childhood. It came from school literature from teachers, and I adapted those into the workplace to talk about what are the things that we might experience at work that are related. And so it has to do with an adverse emotional environment, and covert adverse experiences. Those are both actually pretty related. And it's where there is an emotional safety, and then things that are meant to kind of degrade at the covert experiences are the ones that kind of degrade your psyche. So things like gaslighting, scapegoating, double binds. So a double bind is when uh, no matter what you do, you feel like you're going to get in trouble. Scapegoating is when you get blamed for things even when you didn't do them. And gaslighting is that intentional um, means to make you doubt your own reality. So making you feel like you're the one that is that you're making things up when it's the other way around. And then there's the adverse physical environment, which I think we have a lot more research on. So things that make a job in and of itself kind of scary if your life is at risk when you're in those. And then discrimination, which is another common one that we know about. This is another theory that I pulled from, which it's the discrimination is included in the ACEs. Um, and there's a lot of different types of it. And then neglect is another piece. So this deprivation of resources. Uh, and so workplaces, especially in the US, are important for you to live. And so finding out, like, can you afford to do laundry on your salary? Um, can you afford to provide for your family on your income? Those sorts of things can be a form of neglect when you are working and providing so many hours to a job, but you're still unable to get your basic needs met. That feels like neglect for me. So that's where that fit into there. In my study, I found that when people were experiencing these things at work, it was related to turnover. It was related to psychological distress, like that questionnaire that I mentioned before for PTSD, and then it decreased engagement, conscientiousness, and psychological well-being. And so engagement and conscientiousness are two things that we know are tied to performance. And so the fact that there's a correlation that shows that there is less conscientiousness, and even conscientiousness is a personality trait, which means it's supposed to be stable over time. But there is some evidence that early childhood adversity can lower people's levels of conscientiousness. And there's this state theory of conscientiousness where certain environments they think can lower your levels of conscientiousness. And so it's possible that that's what's happening in the workplace. And so all of these things are adding up to parents who are burnt out and less likely to engage with their children and play and watch TV. And when brains are developing, and there's a Surgeon General's report that recently came out that declared a national health emergency for parenting. Parents are getting burnt out. Everyone's getting burnt out, but the ability for parents to engage with their kids and not just turn on a screen gets a lot harder when you are burnt out and when you're tired after a day of work and you just want to kind of sit, zone out, and not have to be present.